Now we'll talk about albendazole, which is also a congestor of mebendazole with a broad spectrum activity and better tolerability. It has everything is same as mebendazole in albendazole, but the only advantage is that it's single dose administration in many of the infestations, such as in Escherichiasis, hookworm, and Enterobius. Although it has that advantage, but in trichuriasis we can see that mebendazole is more efficient than albendazole. But in strongyloids, hookworm, and hydrated cyst, again albendazole is more efficient than mebendazole. The mechanism of action of the albendazole is similar to that of mebendazole, which I have described in the previous video, but it has weak filaricidal action but can kill cysticerca hydrated cyst and ova of Escherichiasis and hookworm. It is also effective in the cutaneous larva migrans. So basically it is a very strong drug with weak filaricidal action and advantage that it can be given once a day, single dose administration for the infestations. Pharmacokinetic is that it can be absorbed orally, but its absorption is enhanced when taken with a fatty meal. It passes through first pass metabolism where it gets converted into sulfoxide metabolite, which is a toxic metabolite for the parasites. So it is a potent antihelmintic and gets distributed all over the body and the brain, and then it is excreted in the urine with a T half-life of 8.5 hours. So again, albendazole is a congestor of mebendazole with a broad spectrum activity and better tolerability, with an advantage of single dose administration in many of the infestations such as Escherichiasis, hookworm, and Enterobius. But in trichuriasis, mebendazole is more efficient than albendazole. Other infestations such as in strongyloids, hookworm, and hydrated cyst, albendazole is efficient than mebendazole. Mechanism of action is similar to that of mebendazole. It has a weak filaricidal action which kills cysticerca hydrated cyst, ova of Escherichiasis, and hookworm, and is effective in the cutaneous larva migrans also. Pharmacokinetic, it is orally taken, but absorption is enhanced when taken with the fatty meal. It passes through first pass metabolism and converted into a toxic metabolite for the parasite, so potent antihelmintic. Distributes all over the body and in the brain, and it's excreted in the urine with a T half-life of 8.5 hours. Now the contrasting feature of albendazole is that in contrast, the metabolite of albendazole and thiabendazole are inactive. Here albendazole's metabolite sulfoxide is active and potent antihelmintic, while mebendazole's and thiabendazole's metabolite are inactive. Now side effects, there are only GI side effects such as nausea and gastric irritability, all of that. But few patients have also felt dizziness. Prolonged use can cause headache, fever, alopecia, and jaundice. Uses: if there's a infection of intestine and by the intestinal worm, then it is taken empty stomach. For cysticerca, hydrated cyst, cutaneous larva migrans, it is taken with a fatty meal, then it's better effective. Now the uses for it is for the Escherichia, hookworm, Enterobius, trichuriasis. All of the infestation can be cured with albendazole with a different dose. So first we will go and learn about the Escherichiasis, hookworm, Enterobius, and trichuriasis. So we are giving 400 mg single dose to the child greater than 2 years. But if children is between 1 to 2 years of age, then we give 200 mg for treatment. 3 days treatment is required for heavy trichuriasis. Okay, so 400 mg if the child is greater than 2 years of age, and 1 to 2 years of age if 1 to 2 years of age, then 200 mg. Single dose is required, but 3 days treatment is required if heavy dose infestation is there. Heavy trichuriasis infestation is there. So it was Escherichiasis, hookworm, Enterobius, and trichuriasis. We will remember it as a HATE, hate. Then second is tapeworm and strongyloids. For the tapeworm and strongyloids, 400 mg twice a day for 3 consecutive days. Okay, and then trichinosis also, there is a 400 mg twice a day for 3 consecutive days. In strongyloids, efficiency is low compared to ivermectin, so it is a second drug of choice after the ivermectin. For the neurocysticercosis, antihelminth of choice for its treatment. Okay, neurocysticercosis, albendazole is a antihelminthic drug of choice. Cutaneous larva migraines, again 400 mg for 3 to 5 days we will give. Other than that, we can also give for the filariasis and hydatid cysts. So there are total 1, 2, 3, 4, 5, 6 and 7 uses. The first one was HATE, hookworm, ascariasis, enterobius and trichuris, 400 mg single dose if children less than 2 years of age. Then 200 mg heavy infestation, then we will give for the 3 days. Tapeworm and strongyloids, 400 mg twice a day for 3 consecutive days. For trichinosis, also 400 mg twice a day for 3 consecutive days. Neurocysticercosis, it's an antihelminthic drug of choice for its treatment, which is 400 mg twice a day for 8 to 15 days. And cutaneous larva migraines, 400 mg for 3 to 5 days.